Hi, I'm Dr. Shilpy Dolas, consultant breast oncosurgeon. I in Pune. I'm attached with a few hospitals of Pune like Ruby Hall, Aditya Birla Hospital, and Jupiter Hospital. I'm the director of Heart and Breast Care Clinic, which is my own clinic in Pimpri near Magari Stadium. Deals with breast cancer surgeries as well as the aesthetic breast surgeries like breast implants and reductions. Breast cancer doesn't produce any symptom in early stages. It can produce symptoms like breast lumps and nipple discharge in later stages when it is too late. So it's better to detect the breast cancer as early as possible. It's difficult but not impossible. So that's the reason we'll run all the drives on October month to promote the breast cancer screening as well as the mammography campaigns. So let's talk about it, that what exactly the incidence of the breast cancer. So breast cancer generally more common. It's nowadays more common in metro cities like Mumbai, Pune, Kolkata, Karnataka, and Chennai, Delhi. So these are the places when the population where the population is more. Now, why it is more in these cities? There are two, three reasons. One reason is because we run the screening campaign so we can detect the breast cancer in these metro cities as early as possible, while in villages it will get neglected until unless it will reach to the later stage like 5 to 6 centimeter in size or when it will spread to other parts of the body. So that is one of the thing. And the first and foremost is, first of all, it won't create any symptoms. So sometimes even in the metro cities the women are so busy, they are so workaholic, they are so busy to take care of their life, everyone is fighting with everyone that yes, we have to succeed in the life, they are behind their kids' studies. So sometimes they'll neglect. So the thing is that together will create a difference. It will cause the breast cancer to get unnoticed in the females. So these are the two main reasons why we see more breast cancers in metro cities as compared to the villages. Now, if we see the incidence wise, all the Western countries like America and has got 1 in 8. So while in India, the ratio is 1 in 22, which is less than the Western countries, but yes, still it's increasing day by day. What are the exact causes of uh, turning this into the Western countries incidence? The main thing is our lifestyle changes. We are adopting the westernized culture, not a single reason of the breast cancer. You have to understand. While we say that unopposed action of the estrogen, the female hormone, can cause the breast cancer. Now, being a female is an invitation for breast cancer. Why? Because we are rich with the estrogen hormone. We have abundant of estrogen hormone. That's why we are females. But whenever there is an unopposed action of the estrogen hormone and there is a change in the age and the change in the cells, this can cause development of the breast cancer. So how it will happen? It will happen because of the environmental changes, it will happen because of the dietary and chemical changes, it can happen at the genetic level also. However, the incidence is very low, but you cannot neglect it. So as we all know that the pollution is increasing, environment is changing day by day, definitely it is affecting our lifestyle, it is increasing our stress level, also changing our hormones and each and every pattern. We don't have time to eat, we don't have time to walk, we don't have time to eat. What I feel that the dietary habits are also important, not in a short term but in the long term manner. If someone will take care of their diet for 8 to 10 years, definitely they'll develop the good cells in their body. So the main thing is that we are neglecting all the colorful vegetables, all colorful fruits in our diet. It should be included in the diet because they are rich in antitoxins. You will get the natural vitamins. Your cells, the cells which will get generated day by day, they will be healthier than the previous cells. So that should not be neglected, especially in the younger age. If you will work in the younger age, then definitely you will get benefit in your older age. The second thing is that along with the diet, everyone is concentrating on the diet. Yes, we have to avoid the fatty meals, the fatty diet, and I'm not saying totally avoid it. If you are having, then work out for it and burn out those calories, and in that way exercise is very important. Yes, you don't have time for the exercise, I agree, but you have to take out time, at least half an hour for yourself. Other thing is late childbirth. Yes. Third thing is avoiding the breastfeeding. Some women, even they late child, they are not doing the breastfeeding. Now I would like to say that breastfeeding is important. For one childbirth, it is for 1 year. And if someone is conceiving twice, means like two childbirth at the difference of 2 years, then they should at least breastfeed 1 year per child. So in that way, per year, they'll get 4.7% protection, 4.2 to 4.7% protection against the breast cancer. Why? Other thing is hormone replacement therapy. There are some females who will require hormone replacement therapy for their lifestyle. These are the females who are seen by the gynec, and they'll require for certain reasons. I'm not saying that you have to totally avoid the hormone replacement therapy, but it should be under control. If you have taken hormone replacement therapy with your gynec, please follow with your gynecologist. It is very, very important at a regular interval. Don't, if she has called you at every month, or if she has called you every 3 monthly, please go and visit. Don't make it for a year, 6 monthly or 1 yearly interval. So that is very important. And along with that, if someone is on hormone replacement therapy, we'll always say that get the checkup done by the breast specialist also, because if something is coming, at least they can detect, because they have examined thousands of breasts before as compared to you. Now the main thing which we cannot change is the genetic factor. Like genetic things you can't change, but yeah, you can take prevention, you can take precautions for that. Genetic cancers are very, very less. They are 5 to 10% only, but you cannot neglect it. If we in that case, generally the history of the breast cancer or some kind of ovarian cancer or any other cancer is present. These, as we know, that these genes will come from the mother side as well as the father side. So half genes come from mother side and half gene come from father side, and in combination they'll make your genes. So if anyone is affected on the mother side, that also you have to consider, and you have to tell your doctor, as well as on the father side also. Most of the people will think that only the mother side history is important, not the father side history. Father's history, father's brother's history, father's mother's history, father's sister's history, every history is important. So don't neglect those histories. Please discuss with your doctor and tell. The percentage is very less. That's, I've already told you, 5 to 10%, and people will think that that is the only reason which can cause breast cancer. And sometimes the patients are very, very worried when they have a family history of breast cancer, and they'll think that they'll get the breast cancer. That is also not completely correct. There are certain genes, when they are positive, even if they are positive, the patients won't get breast cancer, but they have higher chance of developing that breast cancer. Like, I'll tell you one example, that is called BRCA gene, and you must have heard about Angelina Jolie, and she has spread too much of awareness about the BRCA gene and the positivity and the prophylactic precautions what you can take about that. So if someone is positive, or someone's mother is positive for the BRCA genes, those patients also should not get too worried. They should meet us. They should get the genetic counseling done by us, and then we'll do certain tests if required, and then we'll take care of them in the form of a screening. Why it is important to know the genetic history? Because in those cases we can start the prophylactic measures as well as the genetic screening, or this normal screening, little early as compared to the normal individuals. So what are the screening protocols? What is called as screening? Screening means you just come for the checkup, and a breast specialist will examine you and write down few tests. Sometimes it can be done through the corporate setups directly in the form of mammography, and you'll go to the hospitals and get your mammography done. Yes, you can do it, but don't avoid your mammography to be checked by a breast specialist later on, because sometimes the interpretation are beyond your knowledge. They cannot tell you everything. Even there are some lesions which are Barrett's 3 and Barrett's 4, which you can't understand and you'll Google. In spite of doing the Google, you just meet a nearby breast specialist and get your queries clear. Every time we don't order the other tests like biopsies and MRI, but if it is required, definitely needs to be done. So that includes in a screening, which is called the triple assessment test. Triple assessment means you get examined by a specialized doctor, then get the screening test done like mammography and sonography, and in younger patients sometimes MRI is also required, and followed by that, if any lump or any suspicious thing is present, then biopsy or FNAC of that thing. These three things will make a triple assessment, and which needs to be done for the females, especially for the females who have got the genetic history, as well as for the females who are above 40. So it's a rule, we can say that doing the examination, the self-breast examination by the ladies by themselves, should be started at the age of 20s. Self-breast examination needs to be done 5 to 7 days after your periods, not before your periods, and not any time. It should be done once in a month only, and should be done in a proper position, in a standing lying down position. Should be done for the breast as well as for the armpit also. And if you'll examine, it is said if you'll examine your breast 12 times in 12 months, like once in a month, for 10 years, you will be able to detect the breast cancer in early stage at the age of 35 or 40 if it will happen. I hope it won't happen to anyone, but yes, if the symptoms are there, at least it will be easy for you to catch up those symptoms. Now we are talking about the symptoms, that what are the symptoms. Generally ladies will ask that what are the symptoms of the breast cancer, doctor, how it will present. So there are two types of breast cancers, like early stage breast cancer and later stage breast cancer. Early stage breast cancer won't show any symptoms generally. They'll be detected on a screening, which I've told you, in the precancerous stage sometimes, which is also called DCIS, ductal carcinoma in situ. So if someone will do the screening protocols, if they'll visit a doctor, they'll get something checked, the breast checked, and they'll get the DCIS condition. Only a small surgery or a small measure is will treat the whole thing. They won't require chemotherapy and radiotherapy, but when it will get converted into the late stage, definitely they'll require the whole bunch of the treatment, which includes chemotherapy, radiotherapy, sometimes targeted therapy also. So we have to catch up these cancers as early as possible and detect them and treat them as early as possible, so that they won't turn into the later stages. Definitely the survival rate and the quality of life as well as the quantity of life differs as the stages will change. So that's a common question asked by the patients, that what is the staging of the breast cancer. There are basically, if you take the bigger thing as stages, as stage 0 to stage 4. Stage 0 is the precancerous stage, which I have already told you, which can be caught by during a screening. Stage 1 and 2, where the lump is there, but it ranges between less than 2 centimeter to 4 centimeter. When it is beyond 4 centimeter, 3 to more than 4 centimeter, like 5 centimeter and 6 centimeter, it will land up in a stage 3. In a stage 3, they will get lymph nodes in the armpit. In the armpit, they will get some kind of lumps also, which are present on mammography and ultrasound, as well as during examination by the breast surgeon. In stage 3B, sometimes they will get the lump which is stuck to the chest wall, as well as present as a lump here in the collarbone. In stage 4, it's already spread to other parts of the body. That's the stage which is also called a metastatic stage. Survival rate is very less in that stage. We don't want that any patient will land up in that stage, but yes, the neglection is a main cause. If you neglect too much, if you don't obey the orders, if you don't get the biopsies done, if you don't get the treatment done, yes, definitely the stages will change. It can jump from one stage to directly to another stage also, and skip middle stages also. So it is very important to know the symptoms of the breast cancer. So what are the main symptoms of breast breast cancer. There are mainly 4-5 symptoms. In early stage breast cancer won't present any symptom, but in some patients, most common symptom is breast lump, which is also called a breast ball. It can be painful, it can't be. Sometimes it is not painful. Most of the breast lumps are not painful. So you have to be worried about that. Patients will come to us and they'll say that the breast lump is there, but it is not causing any pain, any harm to me. Having a breast lump is a problem. Breast lump is not normal. Having a breast lump means something abnormal is happening in your breast and you have to get it checked, which kind of lump it is. People will ask me directly that according to your experience, you have felt the breast lump, what kind of lump it is. Yes, definitely I can tell you because I'll examine more than 10 breasts every day. But yes, we'll require some kind of scientific knowledge also in the form of mammography, sonography, as well as biopsy, doing a biopsy, which can prove definitely whether it is cancerous or not, and which can clarify your thoughts also. So never get away from those tests if the doctors are asking. The second important thing is nipple discharge. Nipple discharge is another symptom which will present, which will give an indication for the breast cancer. Now, 1 or 2 drops of nipple discharge is not very important. So it is very important to notice that how much is the extent of the nipple discharge, whether it is coming spontaneously without pressing, how much is the content, whether it is 1 spoon more than that, or it's coming like a fountain. What is the color of the nipple discharge, whether it is reddish, whether it is greenish, whether it is yellowish, or whether it is whitish in color. So all these things you have to discuss with your doctor. You cannot Google it or you cannot sit at home and discuss. In that case, better to go to a breast specialist and get yourself checked. The third is the destruction of the nipple. Some patients have itching and redness of the nipple, which will slowly engulf the whole nipple. The whole nipple will get destroyed. In that case, you have to meet your oncologist or a breast specialist who can tell you about this in detail. It can be a dermat condition, a skin condition like eczema, dermatitis, but you cannot avoid showing that because that will present Paget's disease of the nipple also. So a breast specialist can only detect the difference between these two things. So better to meet a specialist. You come to us, we'll solve your problem. The fourth important symptom is armpit lumps. Sometimes the breast cancer won't come directly in the breast, it will come in the armpit, which is a part of the breast, and present as a armpit lump, or which is also called an axillary lump. Along with the breast lump also, it can present. It's not necessary that only the breast lump is present. I've already told you stages. So in stage 3, it is present in the breast also as well as in the armpit. So those armpit lumps can be detected clinically by the breast doctor, by yourself also as a self-breast. During self-breast examination, you can encounter those lumps, and sometimes you can see on the mammography and ultrasound also. In rare cases, when the breast cancer is already spread, it will present a neck lump here. And last symptom, which most of the patients will say about it, is the breast pain. Breast pain is a late symptom of breast cancer. It's not a first symptom of breast cancer. Breast pain occurs when the stage 3 or stage 4 is there, when the tension of the lump is too much that it has involved the breast and it has caused some swelling or infection in the breast, as well as it has spread in your body and it is causing the weakness in your body or some kind of laziness because it must have got spread to the bones and lungs and other things. So don't wait for the breast pain to happen. If you have the breast lump, meet breast specialist. So it may or may not be a cancer. I'm not saying that all the breast lumps are cancerous. Most of the breast lumps are non-cancerous, but at least the queries will get clarified and the treatment can happen. There are various types of treatments which once the patients will come, we'll discuss all those treatments. So this was a small talk about breast cancer, their incidence and symptoms. I hope you understand in short. For more information, you can visit my website, that is breastdoctorpune.com and breastsurgeon-pune. You can come to our clinic also, take an appointment by calling 8237 337784. You'll get our details on Google also.